Hello, my name is Debbie Komisak. I am doing a video presentation on regulatory environment and evaluating a health exchange concept. A health exchange is also referred to as a health insurance marketplace, and people can buy their own health insurance through them with the goal to reduce costs and improve the quality of care. With the coming about of health care exchanges and the concept of outpatient treatment has risen. This model is that the provider increases the quality of care and patients' collaboration with other specialties. So there is a decreased amount of emergency room visits in the hospital. Unnecessary hospitalizations are decreased, and other tests that would have to be done. All these things would be avoided. So instead of the patients going to the emergency room, more are going to their primary care provider when they are sick. They're going to urgent care centers, which are becoming more numerous, and express cares, and being treated in those types of facilities rather than going to the more expensive hospital. Embedding practice guidelines and clinical pathways. EMRs have the advantage of providing efficient quality information and the elimination of errors. Having the proper information allows the physician to apply the proper practice to the patient. This helps the physician with having to recall from their memory if they have complex guidelines that they may not remember. It does give to their advantage that they could properly remember this, which is an advantage of the patient. It also enhances the efficiency to the practice for the physician. It stands as an avenue for evidence-based medicine to be allowed to be delivered to the patient. Disadvantages can include breaks in confidentiality, privacy, and security. There may always be the problem that the computer system may go down or not work properly. Overall, I feel the advantages outweigh the disadvantages for a physician to be able to collaborate with multiple specialties, and being able to view that right on the EMR helps with the continuity of care for the patient. Demand management is explained as making the physicians primarily responsible for the patients to make better healthcare decisions. It is in this mannerism that its cost effectiveness, proper utilization, and better health will be achieved. Two ways demand management increase consumer involvement is: first, they emphasize on having the patient improve their own health, nurturing wellness, risk reductions, education for reducing the patient's risks, early detection and prevention measures. This in turn makes the patient in control of their own well-being also. Secondly, it helps patients make better choices. The patients are educated on their illness and the symptoms in which doctor visits are warranted. Perhaps a nurse will direct self-care to the patient, or over-the-counter medications would suffice rather than having the patient come to the doctor or go to the emergency room. A lot of triage nurses do this, where the patient calls in and they could direct them what to do at home with self-care rather than having them come in turn this could help reduce unnecessary costs of an appointment, or worse yet, going to the emergency room when it's something that could be managed at home. Comparing disease management and case management entails that they both care for illnesses and conditions of their patient. In disease management, however, the care is directed to self-care in prevention, whereas case management usually provides services of outside nursing agencies, equipment, respiratory agencies, all to help the care for the patient. They both center on educating the patient about their illnesses. I did read where disease management programs have not shown consistent cost savings or improvement to patient health. However, case management was found to be cost effective and provide quality of care.